Well, good afternoon, everybody. Thanks for joining today's webinar. My name is Mike Mackert. I'm the director of the University of Texas at Austin Center for Health Communication, which is a collaboration between Dell Medical School and the Moody College of Communication. We look to improve health for all through evidence-based health communication. I'm involved in the development of the Father's Playbook mobile app, which was created in collaboration with today's speaker. And so I'm really excited to be today's moderator. The webinar today is hosted by the Michael and Susan Dell Center for Healthy Living at the UTHealth Houston School of Public Health in Austin. The center's vision is healthy children in a healthy world, with a mission to advance health and healthy living for children and families through early and impactful interventions. Excited to moderate today's webinar and continue collaborations with this group. I think I got to meet the founding directors when they first got to Austin, so it's been a long time and great partners over the years. Want to say thank you to the Michael and Susan Dell Foundation for providing funds to the center, including today's webinar. And information about the center's work and resource can be found online, scanning the QR code on your screen to access our help resources. The Michael and Susan Dell Center for Healthy Living also leads the Texas Research to Policy Collaboration Project, which creates legislative-related resources described on this slide. And so if you scan that QR code, you can learn more there as well. The School of Public Health in Austin is now home to the Texas Collaborative for Healthy Mothers and Babies, TCHMB. And it's a collaborative of healthcare providers, scientists, hospitals, state agencies, advocates, and insurers, whose goal is to design projects, collect research data, develop strategies and evaluation plans to improve birth outcomes in Texas. The TCHMB Annual Summit is just around the corner. It's a great event every single year. We invite you to register to attend this year's important summit to foster change in family and child health. You can get to the registration through the QR code listed on this slide. And the slides and webinar recording will be archived on our website. So if you have any questions during the presentation, you can put them right now in the chat box, and we'll have some time at the end for some live Q&A. I'm really excited to introduce today's speaker, Dr. Dorothy Mandell. Dr. Dorothy Mandell serves as an associate professor in the Department of Health Promotion and Behavioral Sciences at the UTHealth School of Public Health in Austin, and a faculty member of the Michael and Susan Dell Center for Healthy Living. Her extensive research in family and child health spans various topics, with a primary focus on understanding the intricate connections between early life experiences and later neurocognitive outcomes. She's dedicated to investigating individual and community level factors during the transition to parenthood and the early pediatric period. Dr. Mandell also works with her collaborators to develop and evaluate programs and system change projects aimed at supporting families and promoting optimal brain development in children. I first got to know Dorothy because I was giving a talk about some of the formative research that led to the Father's Playbook app. And I would finish my presentation and say, if there's anyone in the audience who happens to have the resources to build a mobile application, I would really like to talk to that person after the session. And one time it actually worked because Dorothy came up and found me after the presentation, was like, I have resources and would love to build a mobile app with you, which made that basically the greatest panel presentation of my entire life. And so I'm really excited to hear Dorothy today and be part of today's event. And I'll turn it over to Dr. Mandell with her presentation on including fathers in pregnancy and early childhood health promotion. Thanks a lot, Dorothy.
Thank you so much. And that that panel presentation was the best panel presentation I think I ever attended because of how it worked out. The work that we're going to be talking about today, I just want to also make it clear that this is such a collaborative, this has been such an incredible collaboration between our group, who's now at UTHealth and School of Public Health, and Dr. Mackert's group at the Center for Health Communications. And we were just talking about before that we feel like either one of us could give this talk, but it would sound a lot different depending on who was giving this talk. I would like to start off by acknowledging our funder. The Department of Family and Protective Services has funded the work all of the work that I will be talking about today through the Texas Safe Babies Initiative. And the Texas Safe Babies Initiative came to me almost 7-8 years ago from the Department of Family and Protective Services as a way to do primary maltreatment prevention in infancy. That collaboration with the Department of Family and Protective Services, and specifically with prevention and early intervention, has been an incredible partnership. But I do want to say that everything that I'm saying here are those of the views of me, and do not represent official policy or position of the department or of the state of Texas. So Texas Safe Babies was started as a maltreatment prevention program, and the work that we're doing with fathers is one part of a bigger Safe Babies initiative that has become an important part, a very, very important part of the Texas Safe Babies initiative. Texas Safe Babies really thinks about health promotion. And when we think about health promotion and the way that we view health promotion with Texas Safe Babies, we're viewing health promotion not just by looking at promoting health among babies, but an understanding that we can't promote health for babies without promoting health for families. We have to work with the community, and we have to engage in systems of care, and we have to engage in systems change with systems of care. This leads to a very important point when we talk about infant work and the work that we're doing with Texas Safe Babies, is that early childhood work must be 2-generational. We must include parents when we're looking at improving health and well-being of infants. And we have to include the community, and we have to be involved in systems change. So taking in this ecological, socio-ecological approach, this is what Texas Safe Babies is really built upon. And one of the major things that we have been doing in Texas Safe Babies is the work that we have been doing specifically around fathers. Now, one of the other things, grounding things about Texas Safe Babies is that we are not really doing our health promotion work in a way that is really intense. We're not really trying to intensely change individuals and high-risk individuals and individuals with different risk factors. Where we really are is focused on providing long-lasting protective interventions. And that means that we're looking at really populations and trying to impact populations at large. We really want to change the context that where individuals make their differences. When we look at the freedom pyramid, this is where we're focused. We're focused at these really, really widespread programs that probably are going to have small impacts on the individuals, but we really want to start moving the way that populations engage in health behavior and the default decisions that populations make. So that leads to the work that we have been doing about involving fathers. And one of the things that I think we all have to acknowledge is, and this goes back to the panel that Dr. Mackert talked about, but just work that has been happening over the past 20 years, is that we have to acknowledge that as scientists, we've actually ignored fathers a lot. I'm a developmental scientist, and I have to take ownership that in developmental sciences in particular, we have done a terrible job of including or involving fathers in our research and understanding the impact of fathers on early childhood development in particular. When I was at the University of Amsterdam for my postdoc, I worked really closely with Susan Bogles and Evan Acker, who did amazing, amazing work and was my first exposure to how much we have left out fathers of our work. Part of Evan's PhD research was looking at the impact of fathers on early infant emotional development. And one of the things that she was able to show is paternal mental health can really buffer maternal depression. And the impact of that on infant emotional development. The other thing that she was really able to show is that paternal mental health matters, that negative paternal mental health in particular impacts infant attention and emotional development. We see those emotional development trajectories split depending on whether the dad has mental health issues or the mom has mental health issues. That was my first dads really, really matter moment. And to be honest, within the literature as well, the last 20 years has been the moment where we've actually started paying attention and really thinking about how dads are impacting their kids. This literature that has built up over the past 20 years, I'm not going to say it's an expansive literature, but it is a growing literature, has really shown that when fathers are positively involved, the impact on child's executive functioning, you can see the impact on child's executive functioning. Like I said, emotional development, we definitely see some emotional development relationship with the relationship of how dads are involved in their children's lives. There's been actually a long line of research showing positive impacts on father involvement on school achievement and also mental health. So dads matter when it comes to postnatal involvement. Dads really matter when it comes to the development of their kids. For our work, we're really focused on the impact of fathers on that early development and looking back a little bit further to look at how they're impacting and how their involvement is impacting the actual pregnancy and that transition to parenthood. So the bare minimum for involvement for paternity for fathers during that prenatal period is whether or not they establish paternity. And there has been some incredible work that Dr. Cynthia Osborne's group did while they were at while her group was at UT Austin through the Family Research Child and Family Research Partnership. And one of the things that she has shown, and her and I spent a lot of time talking about this, is the understanding that when a father, an unmarried father, signs that APO and signs that he is the father of that child, we see involvement postnatally increase. Those are the fathers that are going to be involved postnatally. One of the other things that Cynthia's group also really showed is prenatal involvement predicts whether or not he signs that APO or not. And becomes and acknowledges that he's the father of the baby. So father being present at least one prenatal visit, that's what she showed, just one prenatal visit is predictive of him establishing paternity. The other part that's predictive of him establishing paternity is whether he's there at birth. And we think that him being there at birth, one, it's a great bonding moment. Definitely is going to be involved after that. Very high probability of involvement after that. But the other thing that we see is if they're there at birth, it also overcomes a lot of the system and administrative barriers that we see exist for unmarried couples with establishing paternity. So it creates this situation that if we can get guys into a prenatal visit, they're going to come to that birth, they're going to establish paternity, and we know if they establish paternity, they're going to be involved postnatally at least up to 6 months, because that's where the literature stops. So of our work with Texas Safe Babies, our work is really focused on maltreatment prevention in Texas Safe Babies with this bigger view of population level maltreatment prevention. And so that has made us go back and then look at the relationship between paternity establishment and maltreatment. And what's clear within our data, and overwhelmingly clear in our data, is the paternity establishment is highly protective of maltreatment for all race and ethnic groups. We see much lower rates of maltreatment if the father has signed the birth certificate. Now, there are some really interesting race ethnic differences that come out of this. In particular, infants of white mothers seem to be at the highest risk for maltreatment when paternity is not established at birth, which goes against, I think, what a lot of people think, which is that this is a risk factor for African American families. The African American family relationship between maltreatment and paternity established is actually complicated. And one of the things that we were able to find is that it's very complicated. There's really culturally specific family dynamics and also systemic dynamics that impact whether or not the father establishes paternity. So within families, African American families, even if he doesn't sign the birth certificate, there are more African American fathers involved, even though he didn't establish paternity, than there are white fathers who are involved who didn't establish paternity. And there's actually a really good literature that has helped build up around this. But that's not really the story that I want to push out. What I want to push out is what this has shown us and really helped us understand is we need to help dads. On the other side, I want to acknowledge that it also means we really need to help moms, especially moms who do not have a partner that's going to establish paternity. They really need some help, but also we need to help dads get through these high-risk situations to help them be involved in their families. We've seen this also with paternity establishment being also a mitigating factor as well. So when we look at those who were substantiated for maltreatment as infants, what we see is the families who are one and done with CPS, which is really what we want. If a family is going to go into CPS, we want them to be one and done. And that means they stay intact as a family, and Child Protective Services never has to interact with them again. And where we see that group of families, the ones that are done and out of CPS and we can't find them in CPS again, those are the ones where we see the highest rates of paternity establishment. Once again, showing that dads in this paternity establishment is protective of the maltreatment happening, the maltreatment substantiation happening in the first place, but it's also helping the family stay out of CPS as the child ages and CPS becomes less involved. So this becomes a situation where helping dads be a part of their lives, be a part of their families, shows a lot of protective factors of really bad things that we want to prevent. So this becomes, based on our research, becomes clear that when paternity is established, the good things are better. And I want to say that when paternity is established and the father is positively involved, good things are really better. So that has led to us to ask the questions, well, how do we make the good things better? One of the things we have to recognize, and Dr. Osborne's research has shown this, and lots of research has shown this, is paternity establishment does not start at birth. This is a process. It is a process of involvement, and paternity establishment is just one way to show that father is involved. But paternity involvement does not start at birth either. It is really a journey. It is a journey into fatherhood. And that has led us, as on the public health side, to say, how do we create an environment that makes that journey positive? So that has led to another line of research that we have done, where we are asking the questions of how fathers are being included, not whether fathers are including themselves in families, but how fathers are being included in systems. And because perinatal systems are incredibly important for us to do health promotion, because when we're thinking about how do we reach fathers, we have to think about where fathers are accessing systems. And there's something I want to acknowledge, and that is that most of our universal systems are actually for mom. Access to healthcare, mental health support. We're doing a lot of incredibly important work to make sure moms can access healthcare, to make sure moms have mental health support through her pregnancy, and now, thankfully, 12 months after she has the baby. That is a system that is built for mom. Also, our largest nutrition system for pregnant people and children is WIC, the Women, Infants, and Children's Nutritional Program, Supplemental Nutritional Program. This is the largest nutrition program that we have in the perinatal period. And that system, also, the benefits are for mom. So who's actually eligible to receive WIC benefits during prenatal care, for example, is the mother. Who's eligible to receive them? Moms are, again, eligible to receive them for a certain amount of time after the baby is born, depending on whether she's breastfeeding or not. So this has given us a system where most of our systems, most of the places that we normally look to touch families, are really systems for her, not necessarily for him. Now, with that said, I hope that many of my WIC colleagues are on the line, and I do want to commend, there are so many WIC agencies here in Texas who have done an incredible job to try to make the WIC office a place for him and a place for dads. In particular, the work that has been done in East Texas is really commendable. But the benefits itself, the benefits are the child and the benefits are for the mom. So that leaves us in a very sticky situation of asking, well, then how are dads involved in these systems that really are for the benefit of the mom? And so that leads us to the question of what do we know? Well, we know that men really want to be involved in perinatal care. They really want to be involved in the prenatal care process. We know that men feel underprepared when the baby is born, and we know that men experience postnatal depression and anxiety too. So what we don't know is a lot, and that is, are men being included in prenatal care visits? Are they learning about caring for their children in the perinatal system? What are the external motivating factors for men to attend prenatal care visits? And what information really sticks with them during the prenatal care visit? There are so many unanswered questions that we have for that. And so we've been, over the past 5-6 years, have been really focused on trying to really understand how fathers are involved in these perinatal systems so that we can best address and maybe reach out to dad through these perinatal systems. And so this has led to a line of research that we have done specifically among nurses, both in the NICU and in the mother-baby units. So those are the units after the mom gives birth. How those nurses are interacting with the entire family and how those nurses in particular are interacting with dads. And one of the things, and so this is perspective from those nurses, and one of the things that we see, especially before COVID, is that we saw very much before COVID that those nurses expected dad to know what to do, but they didn't know how to teach dad what to do. Or they expected him to know what to do, but they didn't teach him what to do. There was quite the conflict that we saw among these nurses about how they were going to include fathers, but they really wanted to include fathers. The other thing that we've seen since COVID is fathers are often othered in health settings. And by that, sometimes I even talk about fathers are expendable in the healthcare setting. They're expected to be there, but when push comes to shove, they're shoved out of that system. And we saw that very much happen during the height of the pandemic, especially at the beginning of the pandemic. Fathers were excluded out of prenatal care, and they were also, in some countries, actually excluded out of birthing hospitals as well. One of the good shining moments that we saw, though, during the COVID is because the rest of the family was pushed out of labor and delivery. One of the things that we saw when we went back and interviewed perinatal nurses is they actually talked about, like, oh my gosh, I can talk to dad now. I can actually do things with dad. And they were making a real effort during that time to bring fathers in to help teach them how to do care for their kids and care for the newborn baby. But what we also saw, and this goes with work that we have done with Dr. Mackert's team as well, is that providers are not really good at talking to fathers. They know they should, and I think they are, but when we look at best practices for how they communicate with fathers, they're not really engaging with those best practices for how they should engage with fathers. Now, that's from the perspective of the providers. When we talk about fathers, we see a very similar stories. Fathers really feel like they're being left out of the perinatal system, but they're really trying to find their way. And one of the things I want to point out too is that fathers actually are okay with being left out of this perinatal system to a certain extent. They really believe that that system is for the mom and the baby. And they really want that system to be optimized for the mother and the baby. So when they get left out or when they get excluded, they kind of accept it. Doesn't mean we should, but they accept that they're being excluded because that belongs to mom and baby. What also we see is they're not prepared for the transition to parenting. I don't think any parent is, but fathers in particular talk very much about being out at sea, not being able to understand what they should be doing, or even being able to understand finding the proper places to go and find information as well. The other thing that we have seen through our research is that they are doing a lot to navigate different different societal pressures. Our families have been doing, I'm just fixing my camera, you all. Our families have been doing a lot of work to navigate cultural pressures because there's not a real good understanding of what fatherhood should look like. There's cultural pressures, there's family pressures, and there's societal pressures, really trying to tell dad what they should be doing. And dads are constantly navigating these pressures. One of the things that's clear that has come out of a lot of our fatherhood work is the understanding that our perinatal systems are actually not focused on the transition to parenthood for either parent. And this is something that we can talk about for later, but as we try to think about that perinatal system and helping that system become a good transition for fatherhood, we have to acknowledge that that perinatal system is also not a good transition to parenthood. What that system is a transition, is a biological transition. It's optimizing the biological transition from being pregnant to not being pregnant. And so that leads to some other issues as we move forward. But what is super clear from all of our work is dads really need help too. Like I said before, there is a clear line of research showing that fathers experience depression at a very high rate. Almost the same rate, especially if you add in anxiety. Fathers are experiencing perinatal depression and perinatal anxiety at a comparable rate to what we see with women. And some of the things that we have seen in our own research and our own work is the seeds for where this anxiety and depression come from. Fathers are also isolated. In a recent study that we did for on a national sample, we found that 41% of all fathers actually didn't have a social support network that they could rely on. And 41% of fathers didn't have a social support network where they could reach out when they were having a conflict with their partner. So we're talking about 40% of fathers being socially isolated as a parent, not being able to have an outlet to talk about issues within the family or issues about being a parent. So that's led to our work about, well, how do we support fathers? How do we support fathers better? And one of the things that we have been trying to do over the past few years is develop the Father's Playbook app. Now, I want to pretend like we did all this research and then we developed the Father's Playbook app, but that's not what happened. We actually were developing this app in parallel with all the research that we have been doing, because that has led to some really great places that we're at right now. So when we first started developing the app, it all came down to that one seminar, that one panel discussion. And I think within 2 weeks, we had a plan, and in a year, we started development on the app. The big question that we have to ask whenever you're doing something around health promotion is, what do you want people to do? And that's a hard question when you're talking about, I want to promote fatherhood. I want to help fathers be good fathers and help support them through their transition to fatherhood. So while we want them to support the mother during pregnancy, we want them to be engaged with the pregnancy and seek information that support the transition to fatherhood. I'm going to be perfectly honest with you. When we started the development of the app, the only thing that we really keyed on is we wanted them to go to prenatal care. We wanted them to attend at least one prenatal care visit. The other thing that we really wanted to do is address what they wanted. And one of the things that comes out of the literature and Mike's really formative research that led to the Father's Playbook app was that guys really want support doing financially planning for the baby. So that's the other thing that we wanted to give them in the app. Since that first version, we've kind of expanded this out and also understand that fathers really want to know about pregnancy-related changes, and they really, really want to learn about how to support their partner. So then that becomes the next question in health promotion, and what are the barriers? What do we have to overcome? And there's lots of barriers that we have found in our research, and barriers that have come up during in the literature as well. That poor parenting transition support prenatally. There's a lot of interpersonal relationships, both with the mother and with the rest of the family, can be a barrier. That's where we see a lot of information gatekeeping happening. Not knowing what they don't know is a major barrier. It's hard to give them information when they don't know that they need to know that information. And guys are receiving a lot of their perinatal and parenting information secondhand. So that becomes the question, like, oh, then how do we promote health behavior change in dads? And there's a big, huge question mark that lies right there. So we zoomed ahead with the app anyway. And the Father's Playbook app is currently released in its third version. In our first two versions that came out very rapidly, one right after another, we really focused on that prenatal care part of it, is trying to get guys into prenatal care, getting them to go into that prenatal care visit because we thought that they would be getting information in that prenatal care visit. So we didn't want to redo the prenatal care visit in the app. The calculator, we put together a fantastic calculator, actually, where guys can put together their entire budget for what they need to do and how much they need to plan to save to pay for all the things to have a baby. In our third version, we also added parenting action plans, which come out of some of my other Safe Babies work. But these are motivational interviewing scripts, little motivational interviewing scripts that we have families walk through, guys walk through in the app with the script. They answer questions based on how they feel about certain things, and the script kind of helps direct them into making a plan to deal with some of these, some issues. And we focused on postnatal issues in the parenting action plan so far. We also have a lot of articles about postnatal articles, because that's where guys feel like they can impact and make a change and really impact their kids. So our goal with the Father's Playbook was to increase prenatal care attendance and increase financial planning. And so some of the data that we have comes from the incredible job that Mike's team has done of getting the app on phones, because just because you build it doesn't mean they're going to come. You have to do a lot of outreach. You have to do a lot of advertising. And this is an old graph. We're almost over 10,000 downloads at this point, with the majority of those downloads happening in the past 2 years, as Mike's team has really refined and worked on the advertising campaign around the Father's Playbook app. So we have all this user information. So that has really given us some really great insight into how do we move forward. And one of the things that we came up with was, what was our predicted read pattern of the original articles? So these are the original articles that we've had from version 1 all the way into version 3. And we really wanted them to read about going to prenatal exams, because we really, really, really wanted them to go to prenatal care visits. Thinking about finances, financial calculator, things that we knew that they had been asking for, birth preparation, how to prepare for the birth. All of this comes out of the literature, and it comes out of Mike's formative research. These are the things that guys really wanted to know about. And signs of depression and anxiety, specifically in the mom.
What we saw though is guys kind of focused in a different direction than what we thought they would. These read patterns are based both on time per word as well as rereading articles. There are 2 articles that are the most reread in our app, and that is Changing Emotions and Men Change Too are the 2 most reread articles in our app. Guys, the articles that they're spending the most time on are really about the changes that she's going through. They are thinking about finances because guys really care about that and are really thinking about what they need to do to prepare for the birth. So these articles are being accessed, a few of those articles are being accessed really high rate. But one of the things that we have to take a second, breathe, go, maybe we got that wrong, is guys did not really care to read the article about going to prenatal exams. This is one of our least read articles actually within the entire app. So this has made us rethink, well, what are guys really getting out of the app? And one of the things that we have found in our research is maybe we actually don't have to encourage guys to go to prenatal exams. The multiple surveys that we have done, both national representative samples as well as samples here in the state, are showing that guys are attending prenatal care exams at a very high rate, at least one at a very high rate. So this focus on getting them in isn't necessarily something they need an app to tell them to do. What's become clear is that what they want from the app is to understand what's happening in the pregnancy. So the other thing we have learned from having the app out in the world for a few years now is that guys consume this information all at once. They're on the app for only about a month, and most of the downloads are happening between the transition between the first trimester and the second trimester. So right when they find out, right when it becomes really real that they're gonna be a father, that's when they download the app, and they all the articles that they are going to read, they have read in a month. And most of the articles, they actually read them in just like 2 weeks. And then what we see going forward in the next month, those are the rereads, and those are going back into the calculator. And like I said before, our most sought after articles is really understanding the change in another person and what she is going through. We've also done some extensive user experience testing in the past couple of years, and this is a shout out to the Saga Lab and the work that we've been doing with Paul Toprak's group in the Saga Lab, who've brought in some excellent developers as well as some excellent student UX testers. And one thing that's very clear is guys want more of those action plans. They really liked them. And in the first version 2 and version 3, we only had action plans happening in the postnatal content. So they would like to build them out, and they would like more of them throughout the entire pregnancy. And they wanted to be able to customize the calculator and the budget. They really liked it, but they wanted more control over it. And they really wanted the information to be on time. And this is really interesting based on the read patterns that we're seeing, where they consume everything all at once, no matter what time of pregnancy that article was most relevant for. They just consumed it all. And so one of the things, even in user testing that we got out, is that guys would like the app to actually curate and time out with pregnancy, the timing of those articles and the timing of that information. So this leads to a whole thing of what have we really learned about fathers, especially in the perinatal period, and how we can best serve fathers in the perinatal period. Is one of the clear things we have learned at fathers is they want the best prenatal care for their partners. That has become clear. And if that means they shouldn't be there, then they're not going to be there. If they think they're getting in the way, they will remove themselves. They want prenatal care to be for their partners and be for their babies. Fathers really want to know all the things, but they really don't know what all the things are. So they're information seeking at a really, really high rate, but not necessarily knowing how to do that information seeking, or relying on their partner to actually curate the information coming in. Fathers really want information about their partners and their coming baby. We kind of thought that they would want things a little bit more father related, but they actually want a lot about what their partner is going through, how the baby's developing, what they should be expecting, and best ways to support both the partner and the coming baby. So what we've also learned is perinatal systems can be alienating. And in particular, we see that with high-risk families, that families with lower socioeconomic status across all of our surveys tend to be the ones to think prenatal care isn't for them and isn't helpful for them. And so they're going, but they're not really getting much out of it. And so that's an important part, that those perinatal systems can be alienating, and we don't want those perinatal systems to push them into a system that's going to alienate them from becoming a father and transitioning into fatherhood. So the other thing that we have learned and become clear is that transition to fatherhood can actually be pretty socially isolating. And I think most people kind of see that the transition to parenthood period can be socially isolating, but women tend to build up a support system around them of other mothers, and our perinatal systems are set up to actually help support building up support systems around mothers with other mothers, whether it's centering care, the way WIC does group classes. There are different ways, or even the way hospitals do group classes. There are different ways that mothers can build that social structure of other mothers around them, but with fathers, we're not seeing that happening. And so the transition to fatherhood can be quite socially isolating, which is something we should definitely address, because that, we know, is one of those stepping stones into the later depression that we see happening with fathers. The other thing that we've learned about fathers is, I think we have this image that fathers are there to be the superhero. And one of the very clear things that I have come out of doing this research for the last 5 years is that is not what fathers want. Fathers do not want to be the superhero. What fathers want is for their kid to be the superhero. And when we think about health promotion, this is an important point to make, that we may be looking at this of trying to encourage him to be the best that he can be. But if we don't add that second point of, because it'll help your kid be the best that they can be, or making that the primary point, I think we're going to be missing the importance of health promotion among fathers. So our next steps. We're going to release Father's Playbook 4.0. It's in development right now, and it should be out at the beginning of the summertime. It should be out at the beginning of the summertime. Based on all of our user testing and all the other research that we've done a lot of changes to the Father's Playbook, and we're excited to test them from both a health promotion as well as a user perspective. One of the things that we have done is add what we're calling snippets, and they're just little points, things that we thought that they were going to learn in prenatal care about what's going on that month. What's a placenta, what's a uterus, when is organogenesis happening for the baby. These little time snippets, just little 40-word snippets about what's happening that month, so that they can get up to speed about what the mom is going through and how the baby is developing. We are also looking at timing all of our information going out to dads. So then, instead of giving him all the articles, I believe we're up to 25 articles, now we're up to 40 articles now. Instead of giving them all at once, we're going to time them out to give them the articles at the time that's most appropriate for him. And developing more action plans. So action plans related to supporting her during pregnancies, action plans about what he can do to support himself during pregnancy and why he should support himself, action plans around different birth preparation. The other thing that we have added in is some customization within the budget and the calculator that guys are putting in. They really asked, like, I want to be able to say that somebody is giving that to me. I want to be able to use this both as a checklist and as a way to budget for going forward. And also, there are many of them who went through our budgeting and said, I could get it cheaper. So let's let them get it cheaper and give them an opportunity to accurately and effectively budget for the baby coming forward. The other thing that we're working on is putting in audio discussions in our app. One of the things that we have seen with guys is guys like to solve problems. I mean, that's no surprise. And so giving guys education without giving them the problem solving to go with the education, that's what we're trying to address. And through these audio discussions with two guys talking to each other about how they solved a problem, we're hoping that this is going to help guys come up with their own ways to solve some of the problems that they see or they need to address during pregnancy. And also some push notifications to bring guys back into the Father's Playbook app as they work through it. The other thing that we have to do is recognize that we can't just promote positive father involvement with just fathers. We have to promote positive father involvement within systems as well, especially healthcare systems. And that goes back to an understanding that these systems need education on how to include fathers. They need education on how to talk to dads. But one of the things I have learned with doing systems change work is they need a tool. And so that's one of the things that we're working on. And one of the things that we're working on developing as we move forward is how do we bring systems back into this a little bit more, to not just say you should include fathers, but saying you should include fathers, and here's how you can talk to dads, and here are some tools that you can give dads, and this is how you can include him in those visits. And within dads, we also know that we need to give them information firsthand. So many of our fathers and so many of our studies relied on another person to get all of their information. And we need to make it a priority to give fathers information about the pregnancy, about the baby, and about their transition to fatherhood firsthand. So how do we help promote health behavior change in new to be fathers? Well, I think as anybody in the audience wants to go out and do something about it, what I would say to you is the first thing is to recognize that new and to be fathers want the change benefit to be in another person. They don't want the change benefit to be in themselves. Their benefits of what they are doing is the benefit for the pregnant partner, and it's the benefit for the child. And putting that forefront in the way that we do health promotion for fathers, I think is an incredibly something that I have become a huge advocate of after doing this research. And we want to reach them directly. We don't want to give guys a flyer that came through their partner. We want to give them the flyer. We want to give them the resource. So we need to not use mom or use the pregnant partner as a gateway to getting dad's information. And also a recognition that sometimes guys like to plan, and giving planning versus giving just education that leads to planning, planning might be more effective. And that's one of the things that we're definitely going to be testing as we go forward with version 4 of the Father's Playbook app. So I would like to say a huge thank you. This is a big team, and this is only the people who are working on the app right now. We've had a slew of students, especially out of the Saga lab at UT Austin, who's been working really, they're the ones that made the app happen. And also within my team, we've had a ton of student designers who really shaped the look and the feel of the app, and the entire team. So thank you very much. And here's my email address and our website, so feel free to reach out.
All right. Well, Dorothy, thanks so much. I learn something every time I hear you talk about things that we've worked on for a decade now, it seems like. Some first questions are coming in. We have about 10 minutes. Is there any particular you want to maybe kind of touch on a little bit more? We'll wait for all the questions to come in.
Yeah, I do. I actually want to kick it over to you because the ad work that you guys have been doing, like can you talk a little bit about that and like how you guys have been testing that and what you've found?
Yeah, this project is a really neat opportunity to do kind of some health communication research in the real world. And so years ago, we had a PhD student working on the project who was really interested in the role of pride in persuasion and health communication in particular. And so we want to test, what is it like is it pride in your future kid? Is it pride in yourself as a dad? Is it a partner's pride in their partner being a good dad? And we had the chance to test that in a couple different ways, like with ads in the real world. And
I have a
so
slide for you.
I almost knew that was coming. And so the idea of, it's like, how far in the future do you put that kid? Because it was really clear in a first round of data that pride in your future kid was the winner, like really clearly. And then we were, as soon as it pride in their first steps, their first good report card. And good means lots of different things. We had asked parents, like, what's the time you were proud of your kid? And it was like everything from like straight A's in kindergarten, which I didn't know was a thing, to the first time their kid got all B's. And it was all over the place. It was really sweet. To first school and off to high school or college, and it was kind of like that middle ground of like 3, 4, 5, 6 felt like far enough in the future, really cool stuff's happening, but not so far in the future. It's like, oh my gosh, that's 20 years away. And so the other thing that makes it really neat for this kind of work is like, we don't want people to know the app exists. We want them to actually download it. And we can see in our data when we do different things, like how obviously you can see spikes in the data. We had done a direct mail piece to OB offices in town or across the state, and you can see like 5-day bumps, especially in the Apple on the yellow lines there. It's like basically on weekdays, you can see the spikes when people are there. I think one of the posters is behind Dorothy there, where you can see like the really clear trends in kind of downloads. And ultimately that's what we care about the most, isn't just like they know it's there, but they can actually go download it. So it's a really neat way to do this work in the real world with data. And that's not the case for a lot of good health communication research. So it's a pretty unique opportunity we have here.
Definitely.
All right. There are some questions in here for Dorothy. So let me ask you, I'll get to a couple here before we run out of time. What kind of consideration toward adding kind of a social aspect to the app? So I think this is a common question when you hear about this, like, can there be a social networking connection component in the app? So what do you think?
I think that we're trying to figure out a way to fake it. We have to be careful with social networking. Mike and I have had this conversation. We had this conversation since the very beginning, actually, of the app about whether or not we wanted the app to be a social network. And we've kind of said no. I'm going to be honest with you. We've said no because there's a lot of muck that goes along when you create a social network and create an ability to socialize. So what we're trying to do instead is create the illusion of socialization within the app. So for example, in the parenting action plans, all of those MI scripts are super conversational and gives him an ability to like talk back. It gives him an ability to make his own decisions. And then the audio clips, Mike, that you guys are working on with the two dads talking through it, like you feel so much more a part of that, and you feel like you're a part of a problem solving session in those situations. So I don't think we can use the app to solve the social network problem, but we can use the app to at least make guys feel like they're not alone.
Another question here is kind of, what kind of content does the app have around postpartum topics, care of the newborn? So what's your feeling for kind of how we think about lots of prenatal content versus all the things, expected or new dads are going to need to know once the baby's there?
Yeah, on the postnatal content, that's like where I feel like the best, that I could do the best on. With the postnatal content, we have done a lot on the postnatal content to really emphasize his important role in development. And one of the important things that I think is that we have added into the postnatal content is education about how the baby is developing and why you are doing certain things at certain times. Like why you're holding the baby close to you when the baby is newborn, why you shouldn't give the baby water, for example, why really giving the guys not you should, but this is how and this is why you should. and putting the messaging that way. So on the postnatal side, we really emphasize play. I'm huge into play is magic. We really emphasize play. We really emphasize talking, and in particular on talking, we understand that all parents with newborns don't understand why they should be talking to their kids. So we really give them the reason why they should be talking to their kids. A focus on physical development and motor development and how they can help support that.
I have a couple questions in the chat asking, and I think this gets to, you were mentioning kind of version 4 of the app and when it's going to launch, around accessibility on the Play Store. Because like there's some, like if you try and download it, like if you want to explain like the timeline things, because some folks are already going to try and download it. And I had questions about how to get the Android version, like what the timing's going to be there.
Yeah, this has been caught up in my transition to UTHealth, actually. So one of the things that happened is, unfortunately, we weren't able to, the Android part in particular, we're in violation. Unfortunately, the app right now is in violation of the right to be forgotten, which we're trying to fix. And this has been one of those things of, there's a lot of technical things that lead to that. But iOS is still available. And so if you have an iOS, please download iOS. We are expecting it to be done. We're hoping and targeting May, that it will be ready to go in May with version 4. And with the Android, we have we may be able to get Android back online pretty soon.
Got a question. I mean, I can answer part of it, which is that the app is free.
Yes.
But you know, Dorothy, do you want to talk about kind of like some of the thinking that went into kind of some of the language and kind of like English and Spanish in the app, and other things that you know are important for all the populations we want to help with this?
Yeah, one of the things I think we learned very quickly is it's really hard to develop an app that is multiple language. And so one of the early decisions that we made was to make the app primarily English, but allow the user to switch in articles and a few other places to switch back and forth between English and Spanish. We live in a very, very bilingual state. And so it may be the situation, we were imagining this persona that was a guy who can read in English, he speaks in Spanish, with his partner and with his grandmother and with his mom. And so going back and forth of him learning how to say these things in English and learning how to say these things in Spanish is kind of the persona that we really thought about by making the app bilingual and giving the user the ability to switch back and forth.
All right, we're running short on time here, but maybe time for one more. I've had a couple of the questions that got sent through were about how the app addresses the importance of breastfeeding and how a new dad can support.
Oh yeah, we have a lot of breastfeeding articles. Like we have 3, right, Mike? Sorry, because we have a WIC article, we have a breastfeeding article, and the WIC article is really focused on breastfeeding. And we have taken a lot of that information directly from WIC, the incredible work that WIC has done to show the importance of fathers in breastfeeding and the breastfeeding decision. And so I think moving forward on the breastfeeding side, our information is kind of jumbled timing. And so creating a breastfeeding app, a breastfeeding article that's maybe for the 3rd trimester about, hey, it's time to start thinking about breastfeeding and whether or not she wants to do breastfeeding. And these are some things that you should consider as a father with her breastfeeding and how that impacts her and how that impacts the baby going forward. And then a postnatal article about this is what you can do to help her while she's breastfeeding.
Well, I just want to say thanks again to Dorothy for this webinar. It was a real treat working on this project for 10 years. I think I've been thinking about kind of everything led to Project Playbook has just been so much fun. And so thanks for taking all the time to share such exciting research with everyone. And thanks to all the attendees for being here. I think we topped out at 450 folks or so. It was a big audience. There's clearly a lot of interest in this. It's really exciting. And the recording slides will be posted on the website, linked with chat within the next 2 weeks. I just want to say thanks again to Dorothy for presenting and everyone for attending. This was really a lot of fun today. So thanks very much.
Thanks, Mike. It was great presenting with you.
It was
Thank
good
you,
to listen to you present.